Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 20 new cases of COVID-19 in Windsor and Essex County. 16 are close contacts of confirmed cases, 3 are community acquired, and 1 case is still being investigated. We have had 16,664 cases since the beginning of the pandemic. 165 people are active at this time, with 91 of our active cases being a variant of concern. To date, 1,875 preliminary or confirmed variants have been identified in Windsor-Essex County. 92% of our cases have the Alpha variant. 19 people are currently in the hospital and 7 people are in ICU. Our community has lost 428 people to COVID. There are currently 6 active outbreaks in Windsor-Essex County, 5 workplaces, and 1 community outbreak. Regarding our vaccine rollout, 305,545 doses of a COVID vaccine have been administered to Windsor-Essex County residents. 260,551 people have received at least 1 dose. Overall, 73.2% of adults 18 years of age and older have received at least 1 dose of a COVID vaccine in Windsor-Essex County, and 13.2% of our adults 18 years and older are fully vaccinated with 2 doses. Residents of Windsor-Essex County 12 years of age and older are able to book their vaccine appointment for a first dose at one of our mass vaccination sites. Please note that select pharmacies and primary care providers are also providing vaccine. Seniors 70 years of age and older are able to book their second dose appointments. In addition, those who received their first dose of a vaccine during the month of March are now able to book their second dose at one of our mass vaccination clinics. Those who received AstraZeneca 12 weeks ago are also able to book their second appointment. For those who would like to receive a second dose of AstraZeneca, please contact your pharmacy or healthcare provider where you received your first dose. If you would like an mRNA vaccine as your second dose and received your first dose as AstraZeneca, please visit wevax.ca to book your appointment at one of our clinics. You may also call our call center at 226-773-2200. If you are eligible to book your first or second vaccine appointment and have booked your vaccine appointment at another clinic or received your vaccine elsewhere, please take a minute to either go online at wevax.ca or call our call center to cancel your appointment. We have a button on our booking site that allows you to view or cancel your appointment. This will allow others to use this appointment time. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. I don't have much to add. We are consistently reporting case rates in our community that are trending down right now, stabilizing at high teens. And today we reported 20 cases. Combined with the vaccines uptake, we are moving in the right direction, and we're hoping that anyone who's still waiting for their first dose, please get your first dose and then get in line for the second dose as well. We are coming to the point where we will be focusing more and more on the second doses. So anyone who is still missing the first dose, please take time to register for the first doses so that we can safely move forward to focus only on the second doses. Please continue to follow the public health precautions. We know that variants are still there, and we still have roughly under 200 active cases in our community. Something that we all have to be mindful of, and there are still roughly about 30% of these cases in our community currently acquired through community transmission. So just please make sure that you're following some of these measures. Stay home when you're sick. That's the most important thing that you can do. Get yourself vaccinated, and if you're still waiting, please go ahead and book your vaccine. Thank you.
We'll now take questions from the media. AM 800.
I will pass on this round. Thank you.
CTV,
No questions at this time.
CBC,
Yes, can you comment on the ratio of first to second doses that are being given out right now? Is it fair to say that demand for first doses is waning? If so, is that happening at a level, a vaccination coverage level that you're comfortable with, or would you like to see it higher?
So right now, we do know that there are 12 plus children that are still getting the vaccine. So we are seeing an increase in the vaccination rate among that group. And then we also know the younger group between 18 to 30, we just opened it up recently as well. So there is a lot of opportunity for improvement in those particular age bands. But overall, across the board, I think in each of these age bands, I'd like to see a minimum of at least 70% in each of the age bands. And we're close, but we still need to make sure that, especially in the younger age group, they see the importance of us of getting the vaccine and book early. It's really important, and I can't emphasize it much, that don't wait. Because right now, we definitely, from a logistic perspective of rolling it out the vaccine, planning for the second dose appointment, first dose appointment, we want to make sure that we have completed our first dose appointment up to a level where we can safely focus all our energies on the second doses. So that's why we're not necessarily seeing a shift right now. I think it's a good mix. We have done our calculation in terms of who's eligible for the first and second doses. And one of the messages that Teresa just mentioned about the when you're booking your second dose, or if you're getting it through a pharmacy or somewhere else, if you already have the book appointment for the second dose, please cancel that so that we can use that appointment. We don't want to see any unfilled appointments in any of these clinics, because it just delays, or it takes away the opportunity for someone who can potentially get the vaccine at that time. So if you already booked your vaccine, if you already got your second dose, please cancel your other appointment if you have.
Thank you. And have you heard anything further about the supply of AstraZeneca and when we're slated to receive more?
Well, I'll pass it on to Teresa to answer.
Well, we do know that the week of June 14th, that the pharmacies will receive another supply of AstraZeneca, as will some of the primary care providers. It won't be a large amount, but I believe it's about close to 5,000 doses. So right now, they do have some, and they're giving that out this week, which is the week of the June 7th, and then next week there is another 5,000 coming to our area.
Thank you.
Blackburn,
Can you just comment on your recent milestone of over 300,000 vaccines administered? Now, what does it mean to reach that milestone?
I think I didn't hear your question correctly. Can you, so 300,000 doses that are given out, that's that your question?
Yeah, just what does it mean to meet that milestone of over 300,000 vaccines administered locally?
Yeah, no, that's definitely a number that I was watching as well, that when we would cross the 300,000 mark, I would be more interested in seeing more than 300,000 people vaccinated. So right now it's a combination of the first and second doses, but clearly shows the work that has gone behind the scene to give out 300,000 doses in Windsor-Essex, and all the hard work of all the health system partners, our staff, our team, the hospital, Windsor Regional Hospital, the city, the EMS, the Erie Shores Healthcare, our primary care providers, our pharmacies. We all had to step in to make sure that this 300,000 doses are given in our region, and it's not an easy task. I can tell you that. It took a lot of logistics, planning, and everything that happened to get to that milestone. We're definitely very happy about it, and it just shows that when we work together, how quickly we can accomplish some of these big things. And on another note, the task is not over yet, we also have to give out the second doses. We also have to make sure that at least 70% of our community is vaccinated. So we are almost, I want to say, coming closer to the midway point where we can confidently say that, we have completed our first dose and we can move on to the second dose and keep our community safe as quickly as possible.
And there continues to be appointments available in Leamington and even Amherstburg more so than in Windsor. Have there been discussions about, changing the distributions, but there are more appointments in Windsor, if that's where the demand is?
Well, we always look at the appointments, booking system, and then what is available, which population, where the demand is. So we constantly look at it, we reevaluate everything, and shift our resources and energy in that direction. We know that there are appointments if needed. What we have done in the past is we have reduced the days of operation in some of these facilities, or reduce hours of operation in those facilities. But we are right now using that opportunity to reach out to the people who are living in the county as well, to use those county sites to get the vaccine as well. So we're looking at all the options, and we constantly evaluate everything on an ongoing basis. And if it needs to be changed, we will change it.
Windsor Star?
Thank you.
Windsor Star?
Hello? Hello?
Hello, do you have any questions?
Yes.
No questions at this time.
Wait. Huh?
Dawson from the Windsor Star, do you have any questions?
Sorry, I think we're doing some cross messaging here. Is Dr. Ahmed available? Am I able to ask some questions of Dr. Ahmed?
Yes.
Okay. So Dr. Ahmed, we're currently not in step one of the province's reopening plan. But I can tell you over this past weekend, it really feels like a lot of people are not following the guidelines. And there's some public opinion that the reopening plan is too slow. What do you have to say about the current mood in the region regarding reopening?
Well, I think first of all, I can understand that what people are thinking and what they're feeling. It's been a year and a half into the pandemic, and with many restrictions and limitations on what people can do, there is this sense of urgency that we want to go back quickly. What my message is to those people is the pandemic is still not over. We are still seeing cases in our community. We still are reporting more than 15, 20 cases every day. And there is an ongoing risk. Yes, with the high vaccination rate, that risk is going lower and lower, but it takes time to build the immunity. It takes time for us to bring the active cases down. It takes time to see what kind of an impact the variants of concerns have in our community, in other communities. We know the Delta variant is increasing in some parts of Ontario, which is posing a threat that if it becomes a dominant strain, it has the vaccine has lower effectiveness against this particular variant. So what does it mean for us? What does it mean for our community? We don't want to rush in too quickly, only to see that it resulted in more cases. And then because of the cases and because of the impact on everything, we may have to scale it back again. Nobody wants that. Trust me, nobody wants that. And it would be devastating for everyone. So instead of rushing it too quickly, I would urge to proceed with caution, ensuring that we're not just pushing our efforts in a direction that would bring more harm than bringing any good. So let's just stick to the plan, so that everyone is following the same guidelines and everyone is having an opportunity to get the vaccine. So I would request everyone to please stay tuned. We already know what the plan and what the pathway looks like. The Premier has already made some of the announcement. our community is moving in the right direction. Even 2 weeks from now, if you've asked me, I was reluctant to say, because we were seeing cases in the 40s, and then there were some days we even saw a case in the 70s. So things fluctuates, but over the last week, I think more specifically, just the last week, we are starting to see a consistent number in the high teens. So please give your community an opportunity to bring the case rates down first before we get to any kind of reopening, because otherwise it would be more devastating for everyone, especially our economy, our business, if we have to go back or shut down. So please be mindful of everyone that would be impacted by it. Take a slow and cautious approach rather than rushing it in.
Thank you.
CFTV,
No questions.
any additional questions from AM 800?
Yes, I'm just wondering, for some people who may have questions about the provincial guidelines when it comes to who is eligible for a vaccine, and why certain health units, Windsor-Essex included, why our availability for people who are eligible might be different from what the province has outlined.
So great question. So we obviously want to stay on top of everything, and we want to do what works for our community, what is more important for our community, and what the logistics and supports and resources we have in our community to do that. There are, I think, more instances that we have gone above and beyond what the province is offering, and there has been time we moved to a lower age band even before the province has made the decision. And there are other times when we took our time before we moved on to what the provincial announcement looks like. But in any case, we haven't, I guess, went against what the provincial guidelines are saying. The messages are typically very well aligned. And it's all because of what the local reality, what the local situation is. And so far, it has resulted in actually a good thing for our community. We have had a very high vaccination rate in our community, and we have beat many expectations and targets well before the provincial average. And we are at least, I want to say, 1 to 2 weeks ahead of where many of the other health regions are. So overall, it worked well, but there are times then that there are differences in terms of what the province is rolling out versus what we do locally, and that is why it is important to look at what the local guideline says, because the local guidelines is where the reality is, and we will do everything for our community to make sure that it works for our community and it benefits everyone. And I just want to emphasize that word, that we want to benefit everyone. We just don't want to take that opportunity to give opportunity for only those who can, who have access and means to take that opportunity. For example, if we just keep our facility to book online, people who do not have access to computer, people who do not know how to use the computer will not have an opportunity to access it. Same idea for the call center, same idea for elderly to get in the queue and get in the line to book a vaccine. So there are a number of logistics that goes into our planning piece that may look different than what the provincial strategy or provincial approach looks like. But so far, I can tell you with certainty that our strategy, our rollout has been working well for the majority. And we are not losing sight on the equity perspective, and we are making it sure that everyone in our community has a fair opportunity to book the vaccine and get their vaccine.
Okay, thank you.
CTV?
I just wanted to get your thoughts on outdoor graduation ceremonies. I know there's been a little bit of controversy regarding that in a short amount of time, but are they safe? Your thoughts?
Well, I think it's a broader question than whether it's safe or not. What we can say is a couple of issues. So one is what the ceremony looks like, what the current public health regulation looks like with respect to gathering and how many people can gather, and that's so that's question number one. And then the second question is, when people are gathering, let's say if it follows some of the regulations, or maybe if there is any exception in the regulation, then what that ceremony looks like, and what are the things in place to ensure the safety and well-being of everyone. And once we answer question number one, when we move on to the question number two, we'll have to work with the school board to make it happen. If it's something that is possible, obviously we try to support everything that meets the public health guidelines, public health priorities. So we'll continue to do that. I don't want to take the role of the school board in making a decision whether they want to do it or not. We are here in public health to support them, and if there's any way we can support them doing that, we will do it. But at this time, I think we just have to make sure that first of all, if it's the regulation allows that or not. So far, the outdoor gathering limit is very limited, so we'll have to be mindful of that. And then secondly, we'll have to see what the graduation plan looks like and how we can support it.
But do you think this will be like a positive boost in the mental health of graduates, and then moving into, more positive territory going into September?
Well, if it can be safely done, if it's allowed in the regulation, I think there are some benefits, which I wouldn't disagree. But it all goes down to the regulation, whether it's allowed or not, and then the logistics that may go into organizing all of that. So we already said stated our position, even from a mental health perspective, that how with the decreasing case rates, the children, if they can safely return to school or not. So we have already made the comment that this is important. So similarly along those lines, obviously we would support the mental well-being of the children, and if it's something that can be done, it can happen. But again, we'll have to look at what the plans, what the regulation states in that regard.
Thank you.
CBC?
Yes, earlier this spring, we saw provincial hotspots get a boost in their vaccine allotment, and there's calls for this to happen again now that everyone is eligible for first doses and second doses are rolling out as well. Dr. Ahmed, I'm wondering what you think of this idea and whether it's, necessary for our region.
Well, I think the hotspot designation and the vaccine allocation, it did help, and it helped our community as well. We had seen the worst cases of COVID-19 in our community, and still by far from an overall case rate perspective, we were at number 4 with the case rates in Ontario. So we have seen some benefits from that, and strictly talking about some of the communities that are still impacted by it, such as Peel region and our GTA communities, Toronto, Peel, and some of the other areas where it is hit really hard. There are some potential benefits to contain it, because unless we contain the cases throughout the province of Ontario, it won't be good for any of us. We are all connected to each other in so many ways, so we need to bring the case rates down in every community. And if the community is still experiencing some challenges, we need to address that. And I don't know if it's just necessarily means that the increased vaccine supply will help it, or maybe more targeted and focused effort in these communities to give them access to the vaccine, remove any other barriers or any other concerns that they have. So just giving out the vaccine, I think it may or may not be the brightest idea. We should look at what needs to be done for those specific communities if they have a low vaccine uptake, and how we can improve the vaccine uptake in those specific communities rather than just making the vaccines available for them.
Thank you very much.
Blackburn?
Yes, just to follow up on some of Christy Lee's questions. The province moved on to allow anyone who got their first dose before April 18th to be able to book their second doses. Are there any plans to match that? And if so, when can people expect to be able to book through the local system?
Great question again. So I think yes, we're definitely on track to match that. The only reason that we broke it in half into the month of March, and then we'll move on to the month of April up until April 18th, is to ensure that those who have received the vaccine first, they can get their vaccine in a timely manner rather than getting delayed for too long, because potentially someone who got their vaccine on April 18th, they can book at a very short interval compared to someone who's booked who received their vaccine on March 8th, but unable to get the vaccine appointment for the next 2 to 3 weeks. So we want to make sure that at least there is some kind of a breakage, because the numbers we are talking about is really high. We're talking about almost 65 to 70,000 people who have received the vaccine in that timeline. And then if you open it up for all of them, it can create really some barriers and challenges for people to get their vaccine in a timely manner. So we made that conscious effort to break it into two halves. So the people who have received their vaccine from March 8th to March 31st, they will have an opportunity to book their vaccine appointment before then the next batch will open up. So sometime in the middle of this week or end of this week, we are planning to match it with what the provincial opening is, which will take them all the way up to April 18th. We haven't forgotten them. It's just making sure, again, it's the part that I was answering to CBC earlier about the equity piece. The equity piece is important. We should not lose sight of that. And there are some barriers for people to book the vaccine appointment. And we, as a public health, we want to make sure that we are removing all those barriers. So everyone will get the opportunity to book the second doses as quickly as possible once we are able to give enough time to those individuals who received their vaccine in the first tranche. So we will move forward with the rest of the batch sometime this week. So if you received your vaccine between April 1st to April 18th, we will get to you sometime this week. So please don't get frustrated. We will give you the opportunity to book your vaccine appointment as soon as we are in a comfortable spot to say that, yeah, anyone who is interested in getting their second dose between March 8th to March 31st, they have had ample opportunity to book, and then immediately we'll move on to you guys.
Thank you.
Delphin from Windsor Star.
I'm looking further, thank you.
CFTV?
No question.
All right, thank you, everyone.